This is Dr. Babu Smadakar, Clinical Director in Neonatology as well as Pediatrics. So today we are discussing on very interesting and very important topic, which is identifying a sick child. Now, when we try to understand what is the difference between adult medicine and pediatric medicine, commonly we say growth and development is the difference, vaccination is the difference and all. But logically also there is a specific difference, which is an adult patient may come with symptomatology in a history which he can speak of. Usually children may not come with a history. It's only the attenders who come and give us the history. But in a special situation like child, if he or she is sick, how do we identify in absence of history? And additionally, there is a most important thing that we need to know, which is how to manage a child in the golden hour, the initial first hour that the child presents to the emergency or a casualty. It is extremely important. So all those interventions that we do in the initial first hour helps us to make sure that outcome of the baby is going to be good. So for the reason that first golden hour is very important, and additionally there is also, this thing has a great role to play as far as triaging a child is concerned. If child is sick, how to intervene and give best intervention at that point of time. If the child is not sick, how to make sure that we are prioritizing our the services at certain point of time and making sure that triaging is well properly done and then child receives appropriate therapy as per the requirement. Now, coming to the identification, the content of the discussion have various contents which include who is a sick child, structured assessment of sick child, which is called as Pediatric Assessment Triangle, initial impression, how do we make initial impression with respect to a child presenting to ER or casualty, the primary survey, secondary survey. In fact, how do we go to the root cause by doing the tertiary survey also, or assessment for that matter. Now, who's a sick child? Where there is, if there is any degree of physiological impairment through the pathway of respiratory, circulatory, or neurological insufficiency, which actually means the most important organs of the body are heart, the lungs, and the brain, the CNS structure. They are vital in maintaining our life. Any affection or any impairment to a certain degree will actually hamper the survival. The end result is going to be cardiac arrest. Unlike other organs, maybe the gut, or maybe let's give for example the muscle tissue. Something happens to muscle tissue, there can be survival in spite of that. Bone tissue, there can be survival in spite of that. But vital structures are brain, heart, and lung, needless to say about it. So eventually there can be, because of impairment of all these three important systems, there can be respiratory or cardiac arrest and severe neurological dysfunction that actually can be prevented if intervened at proper time. Now, vital systems, as we are mentioning, are respiratory system and cardiovascular system. The respiratory system plays role with respect to oxygenation and ventilation, which is actually CO2 washout, and the cardiovascular system has role to play with respect to perfusion. So both together maintain optimal organ function and help in aerobic metabolism. Now, if there is any impairment, there will be cardiopulmonary arrest or failure and presenting with end organ failure, end organ dysfunction, which includes, if the brain is affected, there can be mental status alteration, or there can be lethargy, stuporosity, or coma. If there is alteration in the skin perfusion, there can be alteration in the body temperature. There might be hypothermia that might be happening. There might be color change. The child may become cool. There might be prolongation of capillary refilling. And as we know, the kidneys are most important organs as far as perfusion is concerned. So urine output might get affected if there is impaired perfusion. Now, if you have to sum total, after going through all list of diseases that might hamper a child, we can grossly classify the impairments that might affect the vital systems, which are infections, trauma, toxins, issues which can be congenital or metabolic, and cardiac dysfunction. So infections, for example, infections of lung might range between bronchiolitis to bronchopneumonias and empymas and so on and so forth. Infection of brain, there can be meningitis, encephalitis, which actually impairs the functionality of the CNS. Cardiac tissue, there can be pancarditis, endocarditis, myocarditis, and all those kinds of things. Likewise, trauma might also affect the functionality of the system. Toxins, a whole lot of toxins are there, which can be exogenous toxins sometimes because of the infection. There can be endogenous toxin or produced. There can be congenital anomalies which can have metabolic or congenital dysfunction and cardiac issues. All of these might cause impairment of physiological pathways, predominantly, like we have discussed already, respiratory, cardiovascular, and neurological, eventually leading into the cardiac arrest. So this is a gross categorization of common illnesses, common diseases that might affect the child.